Many people have been waiting for elective surgeries during the pandemic, but some people have been waiting on potentially life-saving procedures. And to discuss, Dr. Oscar Serrano, transplant surgeon at Hartford Hospital, joins us now. Thank you so much for your time today, Dr. Serrano.
It's my pleasure.
Okay, so can you talk to us a little bit about how these services, specifically transplant services, have been impacted by COVID-19?
Well, transplant services at Hartford Hospital have been impacted like many other institutions around the country. The main modification that we made during the COVID-19 pandemic is that we suspended living donor kidney transplantation. The deceased donor kidney transplant and liver transplant programs remained open, as well as the heart transplant program, but those were done selectively. So the decision was for us to take a case-by-case basis. So if an individual came up on a list for a particular organ, we would evaluate their current risk for a COVID-19 infection versus their risk of remaining without a transplant. And if the risk of COVID-19 was lower than remaining in their current condition, we would proceed forward with the transplant.
And you actually just did something pretty interesting. You provided a talk for the Association for Multicultural Affairs in Transplantation about the effect on racial and ethnic minorities. Can you explain some of those details for us?
Absolutely. So we know from the COVID-19 pandemic results on the transplant population that transplant patients are disproportionately affected by the disease. Some of the early centers in New York have published on this literature, which show about a 30% mortality rate for transplant patients. So with that in mind, as well as information that we have that ethnic minorities, specifically African Americans, Hispanics, as well as Asian Americans, are disproportionately affected by COVID-19, they invited me to give a talk. The Association for Multicultural Affairs in Transplantation invited me to give a talk on the two subjects merging together. In other words, how do ethnic minorities fare after having had a transplant during the COVID-19 pandemic?
All right, that's super interesting information. Dr. Serrano, thank you so much for your time today. We appreciate it. Take care.
You're very welcome.